or should I go to another corner?
Hello, everybody, and welcome to the Saaghe Fogwe Podcast. If you're just joining us, get comfortable, get you a pen, get you a book, because today is going to be a loaded session. I'm super excited. You know, I'm excited every week on the show, but especially excited today because I have my colleagues and, in the medical field here with me today. So the topic today is preventive care and collaboration amongst the medical specialties. So every community, and I know mine for sure, struggles with this. And I want to make sure that all communities out there start having some conversations, some really, really deep conversations amongst themselves, some things that we assume that everyone in the community knows. We want to make sure that we educate our community, we spread some information that will save a life or prevent someone from having what illness or some kind of condition that, if they didn't know that information, they would otherwise not be able to prevent. So tonight, again, will be very special. I'm going to go around the room. We have some folks online. So I'm going to, first of all, welcome them in to the studio. I have 2 people online and I have 4 in studio. So let's welcome in Dr. Kathryn, Amba, and Ms. Jane Shiti.
Hello.
Hi, can you hear us? Can you see us?
Yes, I can see you. I can see.
Okay. So we'll start with you guys online. Let's give them, the floor first. Go ahead and please introduce yourself. Tell us where you are. Tell us a little bit about yourself, where you come from, whatever you want the public to know about you, so they know that I'm talking to real people, not robots. We'll start with Doc.
Okay. You know what's going to happen. Hello, everyone. My name is Tifu Amba. I am a nurse scientist at Kathryn Glennon Children's Hospital. I also double as an acute care nurse practitioner. And I also am a U.S. Air Force Reserve officer. Thank you for having me into your show.
Welcome.
Yes,
Jane.
I'm Jane Shiti. I'm over here in New Mexico. I'm a nurse practitioner. I own a family practice here in Albuquerque, Enchantment Healthcare Partners. It's a partnership practice alongside 2 psych nurse practitioners. Most importantly, I'm a mom of 2 boys whom I adore. And I'm super, super excited to be here. I hope at the end of the day, we can go home knowing we have touched even one life in our community. There is so much to talk about collaborative care. We can't talk enough about it. But I just hope at the end of this show, we would throw enough light for us to know that as practitioners, it is of utmost importance to work alongside other specialties for optimal patient care.
Thank you. Appreciate it. So we'll start with the gentleman amongst all these women.
I am Flavious Ferim. I'm a pharmacist. I have done a bunch of things. I've done independent pharmacy. I've worked with specialty pharmacy, infectious diseases. I now work in one of the corporate pharmacies in the place. I mean, I'm not gonna give them free publicity. I also work in the hospital. It's a part-time gig in the hospital, which deals with like long-term care patients. And I'm really glad to have this conversation. I think it's been long in coming, and I'm really excited to see professionals sit and talk and see how we can push the community forward.
Amen. Thank you.
My name is Cemetrice Muhammed. I'm a psychiatric nurse practitioner. I mainly work in the inpatient setting. So I basically see patients from pediatrics all the way to geriatrics. Yes.
She's a woman of few words, by the way. Cut it short.
My name is Atem Dibaki. I've been in psychiatry since 2016. We own a practice in Cedar Hill, Texas, and mainly worked in outpatient. I've also done inpatient and outpatient as well. So I'm happy to be here with Saaghe.
Why are my psych people talking so short? Y'all talk all day.
That's why.
That's
That's
Y'all
why.
are tired. It's a long day. Okay.
Okay. I am Loveline, Nche. I am a family nurse practitioner, and I think I've done it all. But presently, I'm working in outpatient. I own a family practice in Arlington, and I see from 0 to 99 years old across the lifespan. And I just really, really want to thank you, Saaghe, for bringing us together today to have this conversation because I think it is long overdue for us to throw some light and collaborate.
Awesome. Thank you. Thank you, everyone. So you can see we have a variety here from family to psych to the rare breed of acute care, the one with the long initials. She didn't say all her accolades. So I'm going to start with those in the studio. So family, we, my background is family too, so I guess I should introduce myself too. I'm family, but currently in the hormone replacement space, but I still do a little bit of primary care, so I can relate to family. We have to, so our community, one thing that we realize is that most of the time we get to a point where we have family members who get sick, and we only find out at the end stages of it, but these are things that we could have prevented. So I'm going to start with Loveline. Sure. So how do you think that in our community we can get better with educating family members with preventive care, the basic things, as basic as annual physicals?
Yes. So in the family, let me say primary care, what we do is preventive care. And what is that? It's just you trying to do your annual checkups. Most people will come in, oh, I want to do my annuals. They don't even know what is that. We try to, detect the disease before it, you before it occurs. So what we do in primary care is we try to detect it and make sure you do your test early on time. Example, like a mammogram. So we advise you to go in and do your mammogram yearly if you're at the appropriate age. That's what primary care is all about. And I think I've seen on your show so many times people have talked about them being caught with like cancer early, which is the best thing ever. And some people will say, "Oh no, but well, I don't want to know about it." That is what is killing our society.
What I don't know won't kill me.
Yeah. So if they don't know about it, it doesn't bother them. But I would say, knowledge is power. It's very important for you to do your yearly physicals. That's preventive care. So if we detect anything, we can send you to the specialist. That's why we are collaborating. We send you to the specialist so we can handle that early. So basically, it's not much for primary care. Just do your annual physicals, just testing.
And depending on what age group too, the mammograms, not everybody's at that
just
age.
An example.
Pap smears, colonoscopies, all those things. We have to start having that conversation, introducing it to people and making people comfortable, because it's also about knowledge, because most people, they feel like they don't need to do all this blood work. Why do you need to do blood work? And I joke with my patients all the time. I say, hey, if I had x-ray vision to look at you and tell what's going on inside of you, I would do it. But the blood work tells a lot. I can't tell how many people have been diagnosed just because they walked in for something and then you something else, and you asked them to do blood work and you found something else. So moving on to psych, and we'll kind of go around the room here and just touch everybody's specialty. We won't, we might not have the whole conversation today. So I'm going to split it up. I know you see kids all the way to geriatric. You kind of see the same population, but Do you see more adults than kids?
Adolescents across the
Adolescents, all
spectrum.
across the spectrum. So when you so your initial assessment with patients, when you see some of your patients and you have these risk factors in our community, how do you think that for those who have kids, like parents, how do you think that they should start um, identifying some of these things that come up? Because you see adolescents, and for the most part in our community, we have a stigma against psych. Mental health is a bad thing, or it means I'm weak, or it means, we have all these different stereotypes about it. How can we educate our community to get to that point where they're comfortable enough to come to you to have that conversation, to prevent? And we'll go back and forth because I'm going to mix it up. Yeah. So how do you think we should start preventing that stigma?
You know, culturally, in the Black and brown communities, mental health is looked upon as, you're crazy. It's a taboo. We don't talk about things. If you happen to tell your mom that, hey, mom, I'm depressed, I'm sad, what do you think your mom would tell you? Get up, go pray about it, go to church, this, and that. But I'm happy that we're in this safe space to talk about mental health because it's real. It's real out there. People are committing suicides. People are having, a terrible time. So I don't want to think about mental health as in just mental health. We're all here providing holistic care to families. So when a person is to have a heart attack doesn't just happen like that. You start getting subtle changes, or you have to pick up little things. So if your child is going to come talk to you to say, hey, mom, this is happening. Let's go to see a counselor. Let's go see a psychiatrist. Let's go see a primary care doctor. I do believe that there's subtle things that start happening. And if you're vigilant enough, you'll begin to see those things. So it might just be them oversleeping. A person that never used to sleep, now they're sleeping too much. Maybe they may not be eating. They may not be doing good in school for kids. So it's just those little things that you have to pick up and then create the safe space for your children. So by the time they get to see a primary care doctor, or by the time they get to see a psychiatrist, maybe you may have just solved some problems by just saying, what is going on, baby? Can we talk about it? Are you being bullied at school? Is it this? Is it that? And nowadays with our young folks, there are so many distractions. Social media is one thing in this day and age. Drugs out there. So it's very, very, very important to just talk to your adolescents, talk to your kids, even your adults. So much is happening. So by the time you go to see a psychiatrist, pick up on the little things that may have been happening before getting there.
Thank you. That's very important because we're so busy. We're working moms, we're working dads, and these are things that we just, we might ignore because we're focused on the busyness of life. But those little clues, and as parents, it's easy to miss it. You come back and you want your mommy time, your me time, and you might miss out on those things. So I'll go to you, Miss Cece. You're an inpatient, and you see them after they've either already been to the hospital and for whatever reason, and then they found out that they need some kind of in longer stay. She sees them in clinic and you see them long term. Just tell us a little bit about the population. First, describe the population that you see for us and how in our community, how we can also, collaborate with that, like us in primary care, pharmacy, how we can collaborate with inpatients.
So, like I said, I work in the inpatient setting. So I see patients from 5 years old all the way up to 99. And most of the time when they come in there, they come in for like suicidal ideation, like they had a plan to kill themselves, or they actually attempt to kill themselves. We have patients that come in for psychosis, like you were mentioning with the children, the adolescents. They come in for maybe doing marijuana, synthetic, marijuana. So they develop like psychosis. So we have to like kind of stabilize them. They stay in the hospital for about 7 to 10 days, and we try to put them on medication to stabilize them. And then the population that really, really, just really is tricky and really like stresses me out is the geriatrics, because they have the dementia, the Alzheimer's, then trying to fix the right medications for them, and they have all the health problems like you say. So yeah,
Interactions of
yeah, with
meds,
the
yeah, which we'll
medications
go
and
to
stuff
him
like that.
about.
So we have to watch the renal function and all that stuff like that. So we collaborate definitely with you guys a lot in the inpatient setting. And but we do have to talk to the parents, because the parents, they just, some of them in denial. So we just have to educate them, and then they eventually realize like, yeah, my child do need help or whatnot. Yeah. So it can be challenging in the patient setting. Yeah. And they can stay anywhere from 7 to 10, sometimes longer. And sometimes we have to get the courts involved if the patient is very psychotic and not taking medication. So yeah.
Thank you.
I was going to add that in terms of collaboration, 65% of depression is first seen in primary care.
Yes.
So by the time a patient gets to see a specialist, they may have tried and failed on 3 or 4 antidepressants or you name it before the referral to see a specialist.
That's if
So
you're comfortable to because
if you're
some
comfortable,
primary care are like, nope, hands off. I'm sending you to psych even without us
Yes.
doing anything.
Yeah.
So that's a
yes,
collaboration.
some primary
Yeah,
care
yeah.
practitioners are very comfortable managing psychiatric problems, but hey, that's where the collaboration comes on. Because in America, we practice defensive medicine. Nobody wants to be sued for anything. If you get sued, you say, oh, I send this patient to GI, I send this one to neurology, to the pharmacist was there also watching. So defensive medicine in America. So 65%, like I said, of psychiatric illness comes from primary care. By the time they get to us, so many things may have occurred.
Yeah.
So collaboration is key.
Yeah. And I just want to mention back to primary, like some patients, their thyroid levels might be off. That messes with your mood. Vitamin D deficient. I mean, that's depression right there. So trying to educate them, making sure they take care of themselves physically by exercising, eating right, dieting, and all that stuff like that.
Yeah. So before I go to the onliners, I'll go to Flavious. So with pharmacy, we sometimes we don't know what we're doing. We call y'all. Y'all need to be gentle with us sometimes, when we don't know the dosages and all that, but we have to be confident in ourselves, right? But on a more serious note, collaboration with pharmacy. So how do you think we can do better as primary care, as psych, to collaborate with you in terms of medication, like pharmacogenomics, like our genes, our population? How can we do better with making sure that when we get to the point where we know that there's a chemical imbalance and they need medication, we've done all the preventive things. How can we do better with collaborating with you in whatever setting to do better so that we're medicating people properly?
So, look at it from two perspectives, right? The rules of collaboration. The rules of collaboration are well stated. If you have a prescription, if you have a patient, you can always call the pharmacy. You can always get the prescriptions, like the list of prescriptions, stuff like that, if the patient has been taking it, compliance and all those things. But the bigger issue that pharmacists have now is the actual work condition. So we're having this intense problem of being understaffed, overworked. The competencies of pharmacists have increased like markedly. You're giving, like, you have one tech, you have a pharmacist, and you're giving shots, you're picking up the phone. So the breakage in the link of collaboration is now at the level of the pharmacy. So it's all, there is the what is written down in the books and the laws and everything. and there's the actual reality, which makes collaboration very difficult. Now, the rules are there. It's easy. You can pick up a book and read it up. You can pick up the laws of Texas and read it up. But the reality is that if pharmacy doesn't fix his problems, all this collaboration we're talking about,
It will not
yeah,
happen.
I've had doctors call me and they want to check on a patient's prescription. Who has
You
time
don't
for
have
that?
time to do that. And
I'll just be
yeah.
like, can you leave a message on the voicemail? So it's a broken link. Now, conversations like this hopefully would go a little bit towards fixing that. The second part that which is really important, it is we need to look at what we are as a society. You know what I mean? Like our society is markedly different from other societies. We are Africans or African Americans, but I'm gonna speak from my perspective. We have a very different upbringing. We have a very different way of looking at things. We have a very different manner to do things. I'd swear to you that when I was working in an infectious disease clinic in Dallas and Fort Worth, the people who had infectious disease, they came and they saw me and they hid and they ran away. And I totally don't blame them, because we are still at that point where, we grew up the way Africans are brought up. They're brought up in competition with each other. We grew up trying to drag the next person down. So we have hundreds of years of doing that. And now we come to this society, we still have those old instincts in us. I mean, if somebody has cancer, people still think that is something you can use to shame the person. Like, look at this HIV or cancer patient stuff. So the bigger conversation we should be having is, how do we overcome these things to come to this point where, and I'm not saying that people should go around and say, I have these, and blah, blah, blah.
No,
this.
but we should also HIPAA,
Yeah,
HIPAA protect.
And the problem is not just the side of the patient. People just hiding away from me when they see me. Professionals have done some really silly things. So the bigger conversation should be, how do we overcome these divisions that we have, this way of doing things which is dragging us back to come to this point where we, like professionals, we can be cooperating with each other. Lots of people, they would rather talk to a white pharmacist or doctor than talk to your own kind. Or we grow up trained to hate each other. It's something that's the only way that,
to be blunt,
we're colonized. So the bigger conversation we should be having, all these things about collaboration and stuff, it's stated, it's written down. There is a specific way of doing all these things, but we don't do it. And it is our own instincts that have been ingrained in us from where we grew up, our dads and our granddads, that is making us not to do it. And it's holding our community back, because it just, everybody just does their stuff. Somebody comes to the pharmacy and sees me, and he just makes a U-turn. I'm like, oh, I wanted to buy orange juice. I'm like, have fun buying orange juice. You know what I mean? They won't trust me. So it makes it difficult. Like, I can't play my role in society, and I don't totally blame them, because I know people who've done some crazy stuff. So that's why stuff like this interests me. That's why, like, when we're having conversations about medicine, about finance, we're trying to understand that even though we came from this place, we can do things differently. So it interests me to just, I've never met them. I know her, I know you. I'm meeting you for the first time. I'm hoping that you can trust me like a fellow healthcare professional, not just Masadaka, my own boy, stuff like that. You just, like I work with somebody who insists on being called doctor. But nobody calls me doctor.
I know. I've never called him doctor. Sorry.
It starts now.
Sorry.
But that's just the thing. If we can have these conversations, I'm all in.
I know him as my son's godfather. So Anyway, so we'll go to Miss Jane. I see Jane on the screen. So Jane, sorry, it's kind of weird, we'll focus here, but we're not neglecting you. I hope you're following the conversation.
Of course, great conversation going.
So
Um,
you have your practice, your family, and Atem kind of mentioned that already, that we see some of the, like the mental health patients, and you already collaborate with mental health in your practice. Just give us, an idea of your, like preventive care from your perspective, what your focuses are, and how you're dealing with collaboration. I mean, we know you are, but just enlighten us a little bit.
right, right. Um, like Atem said, with co- with collaborating with as the psych my psych team, it's easy for me because I got two on either side of me, on my left and on my right. So if it's past depression, I just send it over to them. But on a bigger, on a greater scale, it's the problem of in back bringing the issue back in our communities. It's having them come to the office, having the first step is being present, wanting to have those labs done, needing to have your hormones checked, needing to have that prostate level checked, stuff like that. That's where the conversation has to start. We have to start talking. Um, and our community, as the pharmacist rightly said, we have a rough upbringing. No, I'll not say a rough upbringing, but different. We think we're healthy until we're an inch away from the grave. So to me, my greatest issue is bringing my community in the office. Once they get there, we have that conversation, that honest conversation. This is where we are. Your blood pressure is 160 over 107. I can send you home. Like this, we have to get this blood pressure down, and we have to follow up, you know. So that's the first place to start. We get those labs done, get that A1C taken care of, check on your mammograms. I cannot emphasize enough. It's amazing. We have kids now 25 years old with stage 2, stage 3 breast cancer. Those are things, check family history. And that's one thing. We don't have the detailed family history because back home, we just realized that people died. We really never had a good diagnosis on what's the cause of death. So most of our family history, my mother is healthy, my father is healthy, even those people with IBS and really GI issues, we really didn't take notice of them. So I realized that with my Black and brown patients, their family history is always very scanty. It's really hard to get to track that effect. So my approach is just deal with it like a blank slate. Like, yeah, like I'm taking a bare plate, a blank slate, and I just throw my kitchen sink in there and run the test. And talking about coordinating with the pharmacist, yes, it's very important. Like even when with my patients with thyroid issues, hormonal issues, I have a compounding pharmacy next to me, and I'm like, okay, I can go ahead and work with you on this, or if you want personalized medicine, I can send you over to the compounding pharmacist. I send your labs there, and she does the recommendation, sends it to me, I put in the orders, and she fixes your medicine just for you. So that is the good thing we have, especially in our rural, in our the smaller states. We can easily pick those providers, handpick your providers with whom you can work with. And 99% of the patients that I've sent over to that pharmacy, they come back really, really excited, because it's not just writing them levothyroxine, it's the pharmacist compounding their Synthroid with whatever things they need in there. And even pain management. we do a good job with that pharmacist compounding pain or medicine to suit a patient's pain. So that's the beauty of it all. But as I said earlier, the first thing is we're not going to do this if you stay at home. You got to get out, go to that primary care clinic, get your labs checked. And sometimes they come to you, they don't even know what they want. I always ask the question, if there is one thing you have to take out of this office, what would it be? That's when you find somebody would think for a second and would be like, okay, I need my labs checked. Oh, can you check my diabetes? And trust me, when they tell you and you check their A1C, it's over 10.
Yeah, 11.
So it's good to have their own perspective of why are you here, not just what I want to do to you or what I plan on doing. It's to establish care that I know, but I can establish all the care I need. If it's not what you want, it doesn't really matter. So what is it that you want to take out of this office when you leave, just so that at least if you take something out, you can come back in the next time, so we continue from where we stopped. So it's that continuity too that's a problem. I don't want to see a patient do some labs and then I never see you again. I want to make sure that I'm dealing with one thing at every visit. So by the time you leave my office, we're done with at least one thing for that day.
Oh, that's amazing. Yeah, I mean, two things that she talked about, the family history, that's very important. That's something that even we can start with us, the professionals, by building our own medical history. I've started doing that because 2018, I had syncopal episodes. I was passing out, ending up in the ER or whatever. So I decided to start writing down my history, because my grandmother lived with us for 25 years. So I was able to know, I knew that she died of a stroke at age 90. So when I, had those episodes, I made sure that I started writing down what I was on, what my parents have, what my grandparents, that way our kids will have that, because at least even if they don't, we don't know what our great grandparents had. We know what our grandparents had. We know what our parents have. Like, I'm lucky to be taking care of my parents. Not everybody is that lucky, but I have that history. I can talk to them. I'm taking care of them. I know their meds. I know. So those are things that we want to start passing down to kids to help change. One thing we can get out of this conversation is to start with us, the professionals, to create a good family history. The second thing she talked about is having people come in to us. We want people to come into us, but I'm going to put a pin on this. We'll have that conversation, but we'll go to Doc to get her view here in a little bit. But we should start thinking about our collaborative care in our community to start going to the patients. Let's start thinking about that. House calls in our community. But I know we need permission to do that, right? They have to let us in. They have to give us the permission. But let's have that conversation after this. Doc, you have the floor. You're the rare breed, acute care, the one that we are afraid of. We talk about you behind your backs. the show breed. So tell us about your practice. Tell us how collaboration works for you and how we can help to make your life, make more sense, like from the family perspective.
Thank you, Saaghe. I would say Tori Day indeed. Tori Day.
Tori Day.
So when we talk about care and collaboration, in my milieu is totally different. I am in the acute care setting. It's second notch in that I'm in the critical care. So by the time all these people that you're talking about that have seen you in the clinic, that have come to your psych place, that have gone to Atem's pharmacy, they go all in circles. By the time I see them, they are already at the end stage, like at your end zone, right? You're playing your football and you get right to the end zone. I mean, that would not be a time to start discussing strategy. It's done. But there's still hope. I'm not trying to say that if you're in the hospital, there's no hope, but I see all my patients there. And with me being acute care, critical care, if you take my machines away from me, you take my diagnostics away from me, you take my consultants, I might not have much use. Knock on wood, A nurse is a nurse is a nurse. So when I don't have those machines and all those other devices, I still bring it right back to the patient. At the end of the day, you have a human being behind whatever you're doing. So always carry conversation with your patient if they can talk. If they cannot, then you would have to use proxy, which would be family member or a loved one or whoever is there. Maybe sometimes you see them as neighbors, or if it's a trauma that comes in and all you see are the injuries, you have to make do with what you have. But when it comes to collaboration, I collaborate with a lot of different specialists. I mean, you would have to collaborate with the primary care person because when that patient leaves the hospital, they are not in a vacuum. They need follow up. They cannot come back to me 2 weeks after discharge to follow their A1C and look at their chemistry or whatever was going on. Somebody needs to do that. So then we'll have to call, let's say I may have to call Jane or I may have to call somebody else in the clinic to do that follow up and continue with them. Interestingly, we are in a society where most of the emphasis is based on the curative side, which means that people wait until they're about to crash and then they try to get care. When you wait until that late, it really doesn't do you much good. We always advocate for preventive care. It's not like we are pushing the work away, but there are certain things that can be taken care of at the primary care level where the patient will not need that. For instance, if you are taking care of your blood pressure very well and taking your insulin as you're supposed to take it, you would not be having a spot in my ICU for hypertensive emergencies or for DKAs. So when we see those people come in right away, there are always two things. Do they have primary care or do they get their medications the way they're supposed to get? Talk about stress, you talk about healthcare, and you talk about the economy. So these people sometimes they know exactly what they need, but they don't have it. So you have a young kid. Yeah, I know I have diabetes, but I don't have money for insulin. So they come into your ICU with DKA, and that is a serious stage. You help them, and when it comes time to discharge, there is no one to do the follow up. So guess where that follow up will take place? In the emergency room.
Emergency room.
So they go right back and come again, and you see it time and time again. So it makes you ponder, why are we spending so much in the ICU level when we could put out more clinicians out there to stop the influx through education, or something as easy as on the primary care side, have a conversation with the patients, or even when you have parties, have a conversation with your family one and loved ones and ask them, how would you want to be treated when you get very seriously ill? So they come in, it's like, I have to establish if they are full code or not, and they'll be like, do everything. That when they come to the ICU, that is not the best environment to be talking about code level. Like, do you want to be on a ventilator or not? You have the vent there already, so you don't really have a lot of choices at that time. But fast forward, I would like to give a special shout out to our pharmacists, because they are very, very instrumental when you talk about collaboration, especially when you are dealing with different medications. We don't have that ability to mix medications. The pharmacist has to do that. Talk about shortage and burnout. They get so overworked that sometimes you have the wrong medications. They put the wrong medications in the wrong containers, and you try to not be passing out blames, but somebody at any given time will drop the ball because of burnout. Then they associate it to shortage. Yeah, there are laws, but the reality is that these laws are there, but if you don't have the staff that needs to take care of you, then nothing really happens. But I'm still thankful that I'm in the acute care setting where I have all my machines to do the things. But collaboration is important. And it's not just collaboration between the professionals, it's collaboration between the family members and the patient and other extended family members, because you might have grandma with 5 different children and you have to collaborate because everyone is telling you different things. But I'm happy that you are bringing us here today to talk about this important topic. To read it.
Yes, I know. Sorry. All right. So yeah. So I put a pin on taking it to the patients because Jane brought up a good point about people not, wanting to make it to the clinic. We usually point fingers at the men, and it's true. Most of the men don't want to, you know. Now I see a lot of them because I'm in hormone replacement. They're coming in for their testosterone, right? They will come for that. Their tea, give me my tea.
Yeah.
But we have to start finding ways to have this conversation, bringing it to the community, making people more comfortable with preventive care, whether it's hormones, whether it's whatever, But what do we think about our community coming together, binding together? Because it's good. We're all entrepreneurs here. I hear everybody has that mindset here. But how can we put this effort together in such a way that our community now we can start going to them? We're most of us are in that sandwich age where we have our kids, we're taking care of our kids, but we'll also have parents that we're taking care of, and some of them, they might be shying away from coming to us. What do y'all think about? We'll go around and everybody, with your specialty and collaboration in mind, how can we bring this? Is that even a good idea to bring? You do a little bit of that already, home assessments. So
Yeah. So before I touch on that, I just want to say something about what I think Jane,
Jane, okay.
yeah, about how we collaborate. We have to try to establish that communication. When you establish that communication, you ensure that we can collaborate together. And for us to have that collaboration, we have to have regular meetings. Let's come to functions. You call us together here today. We created that time to come here today and talk about it. So if let's say in the future, okay, most of us here are Cameroonians. We want to talk about one or two things. We brought our sister here today. Let's have these meetings more often. When you open a line of communication, you establish that trust so we can talk about health. It goes a long way. I would say there are patients where she said they have to come to the office. I will tell you there are patients that come there. You even give them free samples. They go back home, they don't take it.
Right.
Because their pastor told them they're going to pray about it. So it's not even coming, it's about the education. So when we establish that communication, we can educate them better. So if I'm telling your parent one thing, you go back home, your child is telling you the same thing, the pharmacist is telling them the same thing, then the mom will say, okay, this ginger is not working. I have to take my medication. The prayer and fasting is not going to help me. I have to take my medication. Sometimes they say they don't have the money. You even pay for their labs because you understand. Primary care, we do that all the time. You give them free samples, they keep it and come back. Their blood pressure is like 200 and you're wondering why. Because somebody told them that if they just pray and fast, it's going to disappear. So that's what I want to talk about. Then back to your question about community. Yeah. So, I mean, like I said, I've done a little bit of everything. I've done hospice, I've done community nursing. And that is I would say, I love what I do. I really, really love it. I enjoy it. Sometimes my husband will make fun of me that I'm an Uber driver because I go see patients at home. There are times I look at my schedule. I have patients in the office. I prioritize. I look at their age group. I say, you know what? You can make it to my office. I can do virtual. But when I look at that 75, 80-year-old mother in the house living alone, and I know they don't have means to come to my office, I would rather go see them. Sometimes it doesn't pay anything, but just because I love what I do, and I think we should bring that to our community because our people at home as well don't have that means of transportation or somebody to bring them to the office. But again, somebody will be like, do you have the insurance that I can come see you at home? Because most of us, we go with the insurance that you have that we are credentialed with. I have patients that I go to see A, and then they tell me, oh, my brother, my sister, I end up seeing like 5 people. Sometimes I see 7 people in a home that are not even insured because I have 1 patient in that house. It doesn't cost me anything to take care of them, but the liability part of it is what makes you not to do it. But sometimes you're compassionate. So if we bring that to our community where I mean, not only here in America, even back home, through house calls. It's going to go a long way. I'll talk about that at the end because I'm trying to do something like that back home. Yeah.
Yes, Loveline, thank you. I'm going to piggyback a little bit on what you've said. I'm so thankful that as a community, Cameroonian community, we have such a diverse, group of educated professionals. So it's a good thing that we can leverage on what we have. We have the educational potential. We have everything. We have professionals across all specialties. So it's a good thing that maybe 10 years prior or 10 years before, we did not have all this. But I believe that the conversations truly need to start in our kitchen tables. For example, every dinner, if you're talking to your kids about, diabetes, depression, every day you choose the topic and you just create the awareness from there for them to know that it's okay to talk about these things. I don't want to label anybody because sometimes people fail to come to psychiatry because they've been labeled to say, oh, that person would think, say, oh, I'm crazy or I'm that, or if I tell Loveline that I have cancer or if I have diabetes, how would they judge me? How would they treat me differently? They will be judging me from the food that I'm eating. So the conversations truly start on our kitchen tables. And somebody said, treating people first as human beings before diseases or diagnosis. I'm treating you. I'm not treating diabetes. I'm not treating high blood pressure. I'm not treating bipolar disorder. I'm not treating I'm treating a human being. So looking at people as human beings first before a disease behind will help us a long way. So start with this open-ended conversation, safe spaces for people to just talk about their feelings. I think that's where everything really needs to start. I'm bringing it to the community. Yes, we have occasions. I heard even on Theory Day, somebody had mentioned that when you go to parties, I think that was Mike Eno, I think. He said when you go to parties, just do your scavenger hunt to see where the exit doors are, who's going to do CPR, who's going to call 911. So when you have an action plan, we are not in panic mode. You already have an action plan to say, if this happens, this is what we're going to do. And then at least when your kids go to high schools, when they go to universities, when they're working at their stressful jobs with strategies and so forth, at least they've heard something about, at least they have an action plan. I am so sorry, Flavious, our pharmacist. I did not know that when I did not know about the burden that we. But the good thing is that we're having such conversations so that when you're calling us, we're not saying, the pharmacist again. At least I'll be more compassionate to say, I'm used to rolling my eyes. At least I'll be more compassionate to say, okay, they're short-staffed. They're this, they're that. So I'm happy you've created this space for us, Saaghe, to air out some of these things. So, yeah.
Before you say that, you talked about knowing the exits and all that CPR. Wasn't there was a video that went around, about that where somebody, at a party passed out and
nobody knew what to do.
My kids saved my life in 2018. I told you I had syncopal episodes. There was one of the episodes that happened at home. I was face down. My mom found me. And my kids, because I had taught a CPR class during one of the kids, there was a kid conference that Ka did. And I taught the kids CPR. They learned from that event. And so one of them was on the phone with 911. One of them was doing compressions. And that's what saved my life. So think about how good it is for us to start educating our kids, even if they don't plan to be doctors. Let them know basic emergency medicine. Yeah, go ahead.
Like I said before, I'm inpatient. So Basically, when we discharge them, we just set them up with someone like you, make sure they follow up with their aftercare plan. But another thing that I do with my patients that come in for psychosis, I try to educate them on long acting injections because I know we have problems with them being compliant with medications. So I always get up with my pharmacist and try to figure out what we can do for us in like in Vegas, Sustana and stuff like that. So that'll keep them more compliant and they can get the shot maybe once a month or every 3 months or every 6 months. So pretty much my job, I just kind of collaborate with the social workers and then they set them up with someone like you. So
Next time we need a social worker here.
yes, I know some good ones. Yeah.
Yeah.
Yes. Yeah. So
Yeah, I've been keenly listening to the other people. I forgot the question.
I know, right?
it was about coming to to our patients, like going to community.
Yeah,
health,
it's
going to
I think that's the next frontier, and it sounds a little bit overly dramatic to actually call it the next frontier. But again, boils back to where we're from. And the thing with the African, our peer group, is that a lot of people are in their late ages. You look at the life expectancy. You see a lot of people above 35. You know that they're not even midlife again. It's late life. So and one of the things that unfortunate things we brought back from home is the fact of being a struggling people. Like I have friends. I've been playing soccer with them. I used to play soccer quite a bit when I had chance. And they would tell me they had an injury and they've been carrying that injury for 15, 20 years. Now, there are people who are, I mean, hopefully it's just a physical injury, like something in the leg and stuff. But there are people who are carrying more important stuff. And the unfortunate consequence of that is that we have people dropping like flies. Cameroonian died over here, Cameroonian did this over there. And those people hopefully, and it's a sad thing to say, those people hopefully are being teaching examples to other people.
just right up to the wakekeeping.
Yeah.
But after that, no.
Well, somebody is gonna be an example, either good or bad. I remember when somebody died. It was the first time I was talking with friends. I'm like, hey guys, I did my last physical like 2 years ago. I have to go do it. You know what I mean?
Yeah.
So we are at a place which is just I can't even put my hand on it. It's just so strange. I got people who'd call me for medical advice and I'll give it, but they would still say something stupid like he's been bewitched or something like that. So I'm just so confused about I'm just so confused about I'm just so confused about our group, the elderlies. Now with the younger ones, I hope this gets through to them, the kids, the kids who are under 21. I mean, some of them are getting really wild and crazy, but that's a story for another day. But with our group, I am a little bit on that point of just losing it. I've seen so much. I've talked to a bunch of people. I've seen people who just they grew up being rascals. They succeeded being rascals, and they are failing because they are rascals. But they'll take their chances. That's what the African does. So it's a conversation I hope is gonna touch somebody someplace. But I am, to be honest, I'm not really holding my breath when it comes to people of a certain age group and time. You know, I was talking to an acquaintance of mine about one of family was having some health care troubles. So I wanted to see how we can walk through it, stuff like that. I'm trying to be very HIPAA compliant.
Yeah, no.
So I called this guy up and I'm like, okay, this is what is happening over here. Because I would say my things, this is what's happening over here. And the guy told me, yeah, this other family person of his also had that, and that's what they did. I'm like, wait a minute. I thought we were cool. I knew nothing about this. So it's a conversation that hopefully Somebody's gonna watch it on the internet and tell the kids and tell the other ones growing up. There's a lot more collaboration amongst the younger people than us. We were just fighting against each other, tripping each other. I bought a house, I bought a car, I'm the best, I'm this these days. The very ephemeral things that don't count.
Yeah.
They don't really count. Now the lasting solutions that we leave for our community to grow. This is what I hope we are getting into. You know,
Yeah.
I hope somebody will see it and trust us enough, because there's a huge question of trust.
Yeah.
And trust us enough. Like it's not, it's yeah, it's predominant amongst the Africans, especially Cameroonians, because we are so divided. But it's everywhere. But
It's every community,
the difference with the other communities is that they have the numbers to overcome. Like people say that Nigerians united. They're not. They are as divisive as any other African. But if the Igbo people are having, one village is having a convention in over a year, only the population would just trump everything. So it's I I like coming onto spaces like this and like talking, but I leave probably more confused than when I came in, because when I
Why did y'all confuse this man?
no, because when I go back and I start seeing stuff like I'm off this week. I work in the hospital on Saturday. On Tuesday I'm gonna go back to work. I bet you the first African that is gonna come and see me is gonna it's not if it's something ordinary, I can shame him. I can say this crazy blood pressure patient. He's gonna come to me and we'll have a conversation. And if it's something that he thinks, because sadly our society is still like that, I can be like, oh, look at this blah 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 patient. He's totally gonna hide. Totally. So it's a good conversation to have. I hope that is we would have these conversations subsequently, and people, because you have to knock and knock and knock before you break the door. So hopefully people are gonna be like, but wait a minute, these guys have been talking about this for a year, for 2 years, for 3 years. Patience is not our strongest suit, right? I'll bet you, like, the people you started with, everybody is like, So I'm hoping that we would have these conversations over and over and over. The kids we can get, the younger ones we can get, the older ones. Some of us are so set in their ways that sadly, the obituaries that we see are gonna be the examples for everybody. Like, oh boy, don't play with a ringing headache. Somebody's been like, the things that we people used to have as kids. You were like 16, 17, and you had a headache that you never treated. You just like, what, that's
Just
my
like we
headache.
did.
There's this guy who tells me that each time he gets like really cold, his nose starts bleeding. And I'm like, it is not normal. And the guy is like, no, I've been having it since I'm 12 years old. These things, they manifest. Now they're like at the end stage.
Yeah.
So you see 40 years old, 42, 45, they're just dropping like flies. Those things are coming, like the chickens are coming home to roost. Like, it's gonna remind you that you've been having something, you've been having a little swelling on your stomach. And the moment you get to the hospital, the doctor is like, we need to operate like right now.
away.
And the next minute you dead. So we are at that junction of banging at the door until someone hears us. Unfortunately, some people are gonna die and serve like examples. And hopefully we can get the kids to come. That's why when we do things like kids camps and
Yes.
stuff, those things are important, because we are literally, our generation is like all these, big people, doctors, pharmacists. This notice the African doesn't have any major impact on the society. I dabble a little bit in politics, and when no when they elected somebody, and another community in Richardson, they were worried. They came together and they went and met them. They're like, what is the future? What are you guys doing to us? This is what we Africans should be doing. We cannot just say like, you're a doctor, you're a pharmacist, you're this, you're that.
Without it. accounting for
without,
something.
yeah,
Yeah,
it
you have
makes
to count for
it makes no
something. Yeah.
difference. You're no different from the truck driver who drives the truck, because you stay in your house, you have your car, you have your kids. He does the same thing. What's the difference? So I'm really glad to be part of this, and I hope to be subsequently, if I have
Yeah.
time and space.
Please. Yeah. So we need to continue
Sagi,
having this conversation.
just
Yeah.
what I was going
Yes.
to add to what you said, to say, mindful of our cultural, religious, mindsets, I would say that I tell my patients, use all your tools. The church is one tool. I am a tool. You are a tool. Don't just say, I'm going to just go and pray or fast about it. Fast. Use all your tools. The tools
Diversify.
are out there. I just recently saw a patient who believed so much in witchcraft. And I said it was okay.
It does
Believe what you
exist. Good and
believe.
evil fights
I'm not
against
going
each
to be
other.
here to be fighting about what you believe, what I don't believe. The church did this. Use all of those tools. If you have to go to church to pray, go to church to pray. And if something that you still have to take your diabetes medicine, take your diabetes medicine. Because at the end of the day, I often ask patients that, okay, most people in psychiatry, when everything is good, they stop taking everything. So I often ask them, if your diabetes is controlled, does that mean you stop taking your diabetes medicine? So I am a tool. You are a tool. Don't stop encouraging your community. Even if somebody doesn't believe that this is real, or if they want to go to church, go to church. But still come to me. I'll give you all
Give
the
God a little
advice.
help. So give him do your part. Yeah. All right, ladies online. So we're
Yes.
kind of wrapping up here because we don't want to, everybody's tired from a long day, right? And it's a very good conversation, but we wanted to at least prick people's in their attention with this conversation. So we were talking about bringing the with Katu, it's a little different. Going to community, it's not really. So I'll have Jane talk about that, but then Katu, I'll have you start the rounding up. Like, what is your one message that you want to pass to the community and our viewers? But Jane, go ahead and talk about bringing the medicine to people and how you can collaborate with that. It doesn't necessarily mean that you will do it, but how would that help your practice?
Yeah. That's a major issue. For me taking.
Okay.
Can you
Yeah, I can.
can you hear me?
Okay, yeah.
Mm.
Can you hear me now?
Okay, now
Yeah.
I can. Yeah. Mhm.
Okay. Yeah, that's a major issue, bringing that primary care to the community. Um, it is very challenging. Would you want people to be, having a birthday party and you're there talking about some high blood pressure issues or
No
stuff like
private appointments, not during an event.
you know, or it that with our community, it is very challenging, and it's a fine line. When you don't want to turn somebody off. You want to be there for that person, but then recognize when you're not stepping above your boundaries.
Mm-hmm.
It's a fine line. We have to find that line, and that is my challenge, dealing with the community. But as Flavious rightly said, the last month we've had, and I personally know about four Cameroonians who've just dropped dead like that. It is an eye opener to each and every one of us. Over last weekend in New Mexico, we just had not a Cameroonian per se, but one of our in-laws just dropped dead in front of everybody and his kids and everybody. Like we're still going through that trauma of the last weekend, and that was a conversation we had all Saturday and all Sunday. So we're bringing that conversation back to the kitchen table when we sit around and we're drinking our Grand Marnier, whatever we're drinking, we're talking about
My
this.
choice. Why are you? That's what I. Why are you picking
I
on
got
me,
you on
Jay?
this, Saaghe. I got you on this. So we're having these conversations. We are having conversations about the effect of alcohol to our bodies, to our livers. Are we having those checks? Are we being hydrated enough? Are we doing what we're supposed to do to maintain ourselves such that we can continue drinking for a long time, you know? But personally, I would say with my practice, my major challenge with collaborative care, as much as it is getting the care to people, is getting the reports back to me. I send people for GI and I don't get the report. I send patients to cardiology and I have to call that office 3, 4, 5 times for me to get the report. Because what's the essence? What's the point of sending you to cardiology and I'm not in line with what cardiology wants me to do? You know, so that is a challenge for me with my practice. You know, I was telling my front desk staff earlier today, I'm like, we have to make sure we keep a tab of all our referrals so we can call back and get results.
Oh, you see who you refer to.
I send patients. Yes, I send patients to sleep studies, and I don't hear back from the sleep doctor. What do I do? You know,
Call them.
we
Call them.
and we do, but it's a challenge. I mean, if you get a referral from Enchantment Healthcare Partners, when you do that, just fax the referral back to me. You know what I mean? So that is a bigger challenge because the goal for this is just to have good patient outcome, not to have this isolated care. You're doing what you're doing. The ortho is doing what they're doing. Endo is doing what they're doing. I am the family care provider. I have to put all this together, but I can't because I don't have them to put
Because
together.
you're the gatekeeper. You're really the gatekeeper, you know.
Right. So that's a bigger challenge. But this is not just for my Cameroonian community. This is for my whole patient population. And to put more emphasis on mental health, I have had to hold off on primary care visits, right, until my patients are stable mentally. And I tell them, no matter what I do, it doesn't matter how high your blood pressure is. It doesn't matter how high your blood sugar is. If you're mentally unstable, if you don't want to leave, it doesn't matter what I do, right? What I do has nothing to do with you. So I have had to hold off with primary care or medical issues and just go next door. Okay. I stop my visits and say, hey, I'll make an appointment with Charlotte next door. Go there, get settled, and I'll see you in 3 months. I've done that many times than I would like to admit.
Wow. That's amazing. Yeah, Doc.
Yeah. So I'll just continue from
I'm
where Jane
practicing how
ended.
to call my people Doc because I have to
By
respect
the
these
way,
many accolades. Because it's usually just tattoo anyhow.
oh yeah. That's kind of strange, right?
I know.
So they always say perception is reality. So whatever your patient perceives, it might be their reality. So as a clinician, I always try to meet the patients where they are, and then you try to find a pathway to their healing. Because if they're perceiving something differently and you cannot meet them at the range where they are, no matter what you do, unless you're really like using those machines that I'm talking about, you won't get anywhere. To your other question about what we can do in the community, there are a lot of things that we can do in the communities as healthcare providers or just champions of healthcare. We do parties all the time. We sit and we create chat groups that we would discuss politics all night. So why not create chat groups and decide, if you're not going to talk about cryptos or bitcoins. You're going to create this chat group and say on Friday we are going to talk about benign prostate, hypertrophy, or the next week we will talk about hypertension. One time I created a group where I taught the ladies how to do self breast exams, because I'm a certified, they call it certified mama care specialist. So I went to a training that my mentor paid 5K so I could teach and educate people how to do something very simple, how to know their girls and touch and palpate, so you know your own breast. Do not come to my office and think I'm going to assess and do your breast exams. I'm not with that breast every day. That's your breast. You know it. You touch it every day. You feel it every day, so that when you have an issue, you will know what that is all about. So when we have meaningful conversations in our communities, instead of just talking gap, you can sit with your girlfriends and you talk about self-breast exams. If people are interested in that, I would like to come up on this show one day and teach people how to do that. It is mundane. People think they know how to do it, but these are like,
Get more viewers
by the way, I'll bring money.
on the Saaghe.
Another thing you can do is like we can organize health fairs. Just as you make large parties in your big Dallas big party halls, you could do a health fair. The good thing with this is that you can look for sponsors that would donate equipments for you, so you could easily take a drop of blood and you can check somebody's A1C, you can check their glucose, you can check their electrolytes, you can do a lot of things with a little fair. We do them a lot in Chicago, where we organize ourselves and then patients come in. And this, for some people, might be their only opportunity to say clinician. Yeah, we are in America, but I hear we keep saying, oh, because from Africa, there's stigma, you have stigma everywhere. There's poverty everywhere. And you also have situations where people believe in what they believe. So if we, as a community, organize ourselves, and instead of doing a Manjong convention where we are all out there drinking Grand Marnier, we sit and we do like health fair. So I know I can have my Psych, I'll have my I can have my pharmacist right there who explain to me what kind of medications I'm taking. It will help. I can tell you how many times patients come in and I'm doing a med check. What are you taking? Oh, the blue pill. Yeah, that pink one there. What is that? They don't know what it is. And then when you explain to them what that medication is, it's like, wow. I don't want to take a lot of time, but another thing that you can do, if you don't want to use the big fancy halls to do those health fairs, we've talked a lot about the dining table discussions. You can take this also to your church, and these are things that I've done before. When I talked to my church people, they were all like, oh no, I have insurance, I don't need that. So the first week I did a blood pressure screening. We had like 5 people. Second time, we were doing it first Sunday of every month when they have the communion, and then they know it's blood pressure Sunday. The second time, that number doubled. By the third time, I had like 30 people, and some were saying, oh, they have to go have lunch, but they are waiting for Tifu to take their blood pressure. Wow. And my mom was like, what? You have all of these people here. What's going to happen? But you just have to light, they say it's like a fire, right? You create a spark and it's going to burn. So we have to be intentional and we have to be purposeful. But most importantly, we have to have compassion and empathize for what's happening. Try not to judge. It's very easy to do that. Wow. Thank you.
Thank you so much. You can tell she's an educator, right? Through and through, she's an educator. So let's just go around. Last word, final word, whatever you want to leave the community with, your one thing that you really want people to hear from your voice, and go with it today. Just go this way. And you can talk about your project.
So coming here today, to me, I think I was kind of hesitant before, but now I think we just want to go on and on. I am so thankful, Saaghe, again. But the one thing I want to say is that we just have to start by doing what we are talking about. We should stop saying our community is this or that. us here today, we can start doing the collaboration. I send patients to Atem, Atem send patients to me. That is the collaboration. I have some pharmacists that I work with, they're Cameroonians. I send my patients to them. If I know your contact, I'll send you the patients. That's how we start. We sh- if we have to start by doing it. The collaboration start with us. If we teach by example, I think people will follow. If you even go to your church, like she said, that is where the biggest problem I see in primary care comes from, the churches. The pastors don't have no license in counseling. I'm not saying that they're bad, but we tell them something different, the pastor tells them something different. And then we go back, you go all the way to 90 degrees, then the pastors bring you back to zero. So we have to start within us educating and telling our churches to educate, and let's start collaborating. Open the lines for communication. Communication
And
is the
just to
key.
correct, we're not saying people shouldn't pray.
No, you
We're
have
not,
to
we're
pray.
not here. I'm a
That's
No,
pastor's
Atem
child.
already said no.
Right.
I will
not-
correct
yes.
that. Atem already said use
Yes.
all your tools.
Yes, all your
Don't
tools.
use one and you forget about the other one, because so many patients will just hang on one thing which is easier for them and say medicine is bad. No, people have been to school, they've studied, and they know it's good for you. Some people will tell you, oh, they're hearing voices. God is telling them something. No, you're hearing voices because you're sick. Take your medication. Go to Atem. Go to the psychiatrist. You're hearing voices. It's not somebody in your village bewitching you.
The village people.
So all I would say, let's start by open the lines for communication. Let's collaborate and let's stop blaming each other. Let's start doing it by example. And thank you again, Saaghe.
Atem.
Thank you, Saaghe. I think most of us have said it all. Let's start talking at our kitchen tables. Let's talk to our friends, to our children, to our community. We are the tools. We are the tools. Spread it to our communities that we have tools. Let's use all our tools. I pride myself as a mental health advocate, also as a kidney advocate. And one thing that saved my family's life was just simply doing the labs, especially for our men in the community. I donated a kidney to my husband.
Yep, she did.
So I'm going to come back to
Yes.
this show
Your
to
spot
talk
is still
about
waiting
about
finish
that,
our conversation.
because we have a nonprofit coming up. But it started by just simply going to see a primary care doctor and realizing that something was wrong. And from that journey, that led to kidney transplantation. And I was the donor. So that is another thing that I'm going to be talking about still, because I'm a living donor. So these things are real. I've been through depression and back. So I'm a living testimony to say the community is here for support. Use all your tools. And no judgment, no labeling. No judgment, no labeling.
Okay. I know I haven't said much all night, but
Woman of your
but I tell all my patients, make sure they get therapy. We don't have a therapist tonight, but therapy is very important. 30% medications can only treat 30%. The other 70% is therapy. Develop some coping skills.
She's really little few words.
Yeah.
Yeah,
Anything
I really want to. I concur with what the other people are saying, and one of the other things I need to add is, as a healthcare professional, you need to not only talk the talk but walk the walk, and it's something that I try to do. There's some things you won't catch me doing. I mean, if you're not inspired by what I'm doing, that's fine, but that's who I am. I I I I wouldn't go and play soccer at 10 o'clock in the morning and somebody brings a packet, a 24 pack of Heineken and everybody's drinking. I wouldn't drink. I'll go home. I wouldn't do that. So I encourage healthcare workers and people who are cognizant, because it's another way of teaching people. It's another
Just
way
feel
of
about my grandma.
no, it's another way of sensitizing the population,
Yeah.
right? Walk the walk. Like you want to make people understand these things. You want to make people understand that these things work. I I exercise quite a lot. I
Mhm.
run and I do stuff, and I tell people, I put it on my status, I make people see it,
To encourage them,
you
not
know,
to brag.
because that is where the conversation starts. Like, who are you talking to me? Then you show them your
Yeah.
track record, you know. So I encourage healthcare people not only to have a conversation
Yeah.
but also live the life,
life.
right? Like, do the things. Like, sometimes you could be like, okay, no alcohol, drink water or stuff like that, but it's another way of letting the community see. They see the way you live your life, they see the way you do your things. You know, there are just some things that you shouldn't be doing. And as healthcare workers, because before we go out there to have that conversation with everybody,
Mhm.
you know, because that's where you get authenticity, right?
Mhm.
That's where you get the credibility that, okay, you know what, this person doesn't do this and that. And also, um reaching out to the community is a two-way street. I think I said it at the very
Mhm.
beginning.
Mhm.
We have to be really, really careful to not only gain the trust of the community but keep it.
Yeah, keep it.
Yeah,
Mhm.
I see some weird stuff. Sometimes I look online and go on social media and see some really weird
Yeah.
stuff that people are diverging, and it's dragging us back.
Yeah.
There's some things that shouldn't be said.
Yeah.
There's some things that should not be done. You know, we have to be really cognizant. We should be having these conversations, but we also have to be really cognizant of the fact that just one misstep can take us like 10 steps back. So I'm going to encourage everybody, like, let's come again and have a conversation and talk
Yeah.
about some other things. I'm really passionate about the way the Cameroonian male is it's navigating his way through life. You know, I talk with my friends all the time, and we joke, we like, we need to meet, but I won't meet with you if we're not talking anything important. I don't do hangouts. I don't remember the last time I hung out. I know he hasn't seen me for the longest time, but he's cool. He's my brother. But I don't do that. We have to live honest lives. We have to live honest lives. So I encourage people to do that. Let's have these conversations. Let's live honest lives. I should learn something from you when I hang out, health wise, socially. You know, it's a whole holistic thing. So we'll have another
We
conversation some
will.
other time.
We will. Yeah. This
So
is not
I
the
think I
end.
missed
Yeah.
something. Let me just round up when I can talk about the keep the other thing, like doing what you know. Also, you talking about walk the walk.
Yeah.
When you brought up the topic about bringing the healthcare to the community, I said that's what I love doing. So that's why I started the foundation. I have a foundation for my mom called Mary Alia Foundation in Cameroon. Like Dr. Cantu was saying, there are so many tools out there. If you just ask, I think I was in Cameroon in December and I gave medical supplies, almost 2 containers. What about 300 million? I didn't spend that much money, but because I had to go ask myself and my husband, we did all of that. But I'm saying that if you reach out to the population and gain their trust, they will come up because how I launched the foundation by doing free testing. So in 2023, I went home, announced I did a publicity over the radio that I'm doing free testing. People came up. There were a lot of people that didn't even know what they had. So I just diabetes. I think I did diabetes, cervical cancer, hypertension, and all that good stuff. It didn't cost us up to 2 million francs, but we diagnosed a lot of people. People didn't even know what is hepatitis. So we came back with all those medical equipment to help them to donate to the underprivileged. So that's us trying to reach the underprivileged, going to the community because some of them will not go to the doctor because they don't have it. So if we walk the walk, they will trust us.
Yeah.
Because when I came and launched, I told them I'll come back, and I came back. So I'm going back again because why am I doing that? Because my mom passed away, struggling to have health care. She didn't have that much knowledge. So I told myself I will do something to help other people don't go through what I went through by doing house calls because I was be on the phone trying to call to talk to the doctors. Once they discharge you back home, you go home. There's no therapy, no PT, nothing like that. So that's what I'm bringing now for the house call back home. where the doctors can go see the, you know, patients at home. The nurses can go see the patients. There are so many people here that have their parents back home and they don't have people to help them, you know, check on their parents.
You need to share that
Yeah.
information. I'll drop it
So
on
yeah,
the,
that's what we're
under
doing
the
now,
video.
to do house calls. You know, we do good references, check the people. So you go to the houses, 12-hour shift to go check on them.
That's amazing.
And I'm telling you, so many people need that.
Yeah.
So many people. So community nursing is the best.
Yeah. Thank you so much for sharing that. So I don't have much to add. You guys heard it all on this show today. This is just the beginning of the conversation. We've just started. There are probably questions on there. I will answer them later, or if there were comments and stuff like that, we will answer them later. It's been a long show. I know people don't like long videos, but this is one that you have to watch. So if you're out there, please share the video in, you know, people can watch it later because they will get a lot of resources from here. And again, we're just starting this conversation. You will see these faces again. This is probably the new board of directors of the new initiative that we'll have in the community. Hey, you never know. We'll remember this day, February 21st, 2024 is the start of something new. But thank you guys for watching. Thank you for following. Thank you for sharing the video. Thank you for subscribing. Until next time, stay blessed.